Our session today is about anatomy of the noun and plural. This plastic sample is for the right lung. could I know that this is the right lung? I will put the lung in the anatomical position. This is the costal surface. And as you know, the costal surface is anterior costal, lateral costal, and posterior costal. On the anterior costal surface, you can see this line on the plastic model and that line on the plastic model. The plastic model lines here represents the fissures of the lung. And that's why you can see that this is the oblique fissure represented by this line, while this is the horizontal fissure represented by this line. And these two fissures separates the lung, the right lung on this surface into upper lobe, middle lobe, and lower lobe. Of course, the upper and middle lobes of the right lung are mostly anterior, and they are separated by the horizontal fissure, while the middle lobe and lower lobe are separated by the oblique fissure. And you can see that the oblique fissure could be seen also here on the back. And below it, this is the lower lobe, while this is the upper lobe. At this anatomical position, you can see also that the lung is conical in shape. It has an apex and a base. The base could be also called diaphragmatic surface because it is the inferior surface of the lung. And so you can say that the lung have costal surface, which is anterior costal, lateral costal, and posterior costal, and lower surface or inferior surface or base or diaphragmatic surface. In addition to the costal surface and inferior diaphragmatic surface, from here you have a mediastinal surface and medial vertebral surface. In addition to the surfaces, in an anatomical position, I may call this border as the anterior border of the lung, and I may call this border as the inferior border of the lung. Considering the medial surface, there are much to say about the medial surface. First, on the medial surface, you can see the oblique fissure, and also you can see the horizontal and oblique fissure. These fissures are not only seen on the costal surface, but also could be seen on the medial surface. And this medial surface is divided into a posterior medial part, which is this one, that is also medial, but this posterior part of the medial is related to the vertebral column, and sometimes it is called medial vertebral surface. This medial vertebral surface is rather rounded and may be termed as the posterior border because this is the anterior border. So the posterior medial surface, which is rounded, sometimes described as not posterior medial, vertebral medial, but posterior border. In the front of the, or anterior to the medial vertebral surface is the hilum, or the root of the lung. And you can see inside the hilum, there are many bronchi and arteries and veins. And all of these are surrounded by a plural, which is a reflection of visceral to parietal plural. This reflection forms in its lower part a fold, which is called pulmonary ligament. That is the fold of pulmonary ligament of a plural. This fold surrounds the whole hilum or root of the lung. The structures in the root or hilum of the lung, some of them are small and could not be demonstrated in gross anatomy, like lymphatics, nerves, bronchial vessels, but the big structures in the hilum could be demarcated, where we can say that the bronchus is behind in the hilum of the lung, and the artery is above to the bronchus, and there are, which is this one, and there are two veins anterior. And in the right lung, you have a bronchus above to the artery, which is this one, that is the arterial bronchus. Of course, this is a plastic sample. Here it shows two bronchi, that must be one, and shows two veins that should be, three veins that should be two. But the principles is the same. The red structures here are inferior to the bronchus, so they are the pulmonary veins. The blue one is the pulmonary artery. And above it, this is the epiarterial bronchus. This is how. The hilum of the lung, which is anterior to the medial vertebral surface, is surrounded by many impressions in cadaver and in plastic samples. Just behind the hilum, on the right lung, from above downward, this is the region of the esophagus. Above the hilum, the region of the esophagus, anterior to it, this is the region of the trachea. More anterior to the region of the trachea, this is the region of the brachiocephalic vein. And if you descend into this region of brachiocephalic vein to be in front of the hilum, this is the region of superior vena cava. In front of the region of the brachiocephalic vein, which is the right brachiocephalic vein, you can see an angle in the right border, which is the angle for the first rib. I will repeat that. Behind the hilum, from down upward, this is the region of the esophagus. All this is the region of the esophagus. Above the hilum, the region of the esophagus, anterior to it is the region of the trachea. And anterior to the region of the trachea is the region of the right brachiocephalic vein. This region of brachiocephalic vein, if you descend in it to be in front of the hilum, this is the region of superior vena cava. The region of the right brachiocephalic vein is demarcated by an angle on the anterior border, which is for the first rib. Of course, the superior vena cava impression leads to the impression produced by the right atrium of the heart. This is the impression for the heart, right atrium and right ventricle. Okay? All of these structures are clearly seen in the plastic sample. Some of them will be much clearer in the cadaveric sample, and the others will be less clear, as follows. This is the right lung in anatomical position. I can see here, this is the horizontal fissure separating the upper lobe and middle lobe, while this is the oblique fissure separating the middle lobe from the posterior lobe or anterior lobe. In this cadaveric sample, just look to the depth of the fissure. The depth, it is very deep. And just look to the glistening appearance of the lung. The glistening appearance is due to the pleura covering the lung. The pleura is a membrane, wouldn't I know? So the glistening is the visceral parietal pleura. It is on the lung. And you can see that this visceral parietal pleura dips into the fissure. So the lung surface and the fissure is covered by visceral parietal pleura. You can see on the cadaveric sample how the costal surface shows grooves for the ribs because it is embalmed by the formalin. You can see the apex. All of these could be pointed in the exam. You can see the base, which is inferior diaphragmatic surface. You can see the lower border. This is the lower border of the lung. You can see the anterior border. This is the anterior border. So this is the costal surface, which is anterior, lateral, and posterior. And this is anterior surface. And that is the medial surface. You can see that the medial surface posteriorly shows a medial vertebral region, which is rounded and sometimes called posterior border. In front of it, you can see the hilum of the lung. It is separated by, or it is surrounded by pleura, but it is not clear in this sample. The pulmonary ligament is not clear. Maybe this one. I can see that there is a bronchus behind, an artery above, and two veins anteriorly, but they are not so clear, just like the plastic samples, right? But if I will color this region behind the hilum or the right lung from above downward, you must say this is the region of the esophagus. The upper region of the esophagus above the hilum, which is this region. Anterior to it, this is the region of the trachea. And anterior to it, this is the region of the brachiocephalic vein. And that is the angle for the first rib. Okay? And this is the impression for the heart, for the right atrium or right ventricle. Right? The same could be seen on this right lung. You can see how deep are the fissures. You can see the area of the esophagus behind the hilum. All this is the area of the esophagus. Anterior to it is the area of the trachea. Anterior to it is the brachiocephalic. The brachiocephalic, of course, if you descend to it, in front of the hilum, this is the area of superior vena. And this is the angle for the first rib on the anterior border. Now I will turn to the left lung. This is the left lung in its anatomical position. I can see that the left lung is showing in the plastic sample one line representing the oblique fissure separating the upper lobe from the lower lobe. This is the costal surface, which is rather anterior, lateral, and posterior. This is the apex of the left lung. This is the lower border of left lung. This is the anterior border of left lung. And I can see that the anterior border is showing a notch, which is the cardiac notch. Below it, the anterior border, below the cardiac notch, is called the lingula. It is part of the upper lobe, as you can see. And this is the inferior diaphragmatic surface, while this is the medial surface. And again, this is the medial vertebral surface that is rounded and could be termed as posterior border. In front of it, this is the hilum of the lung. It surrounds the bronchus behind, an artery above. The artery is blue in color, and two veins anteriorly. And of course, here we have much variation because this is a plastic. And this is the pulmonary ligament, which is the fold of pleura surrounding the hilum and extended below it. Behind the hilum, the region this is the hilum of left lung. Behind it, this is the region of the descending thoracic aorta. And the descending thoracic aorta continues with a groove above the hilum, which is for the arch of the aorta. The arch of the aorta above it is a groove for the left subclavian artery, left subclavian vein, or brachiocephalic vein, sorry, and this is the angle for the first rib. And behind the groove of the subclavian vein is the region for the esophagus and trachea. I will repeat. Behind the hilum, this is the descending aorta groove. Above the hilum, arch of aorta. Above the arch, region for trachea and esophagus. Left subclavian artery, brachiocephalic vein, then the angle of the first rib. And this is the impression for the heart. Before I will pass to the cadaveric sample of the left lung, I forget something to be said about the right lung. Here in the left lung, the hilum, above it is an arching groove for the arch of the aorta. In the right lung, I forget to tell you that this is the hilum. Above the hilum here is an arching groove for the azygos vein that is connected with the superior vena cava groove. And maybe we have to look to it in the cadaver also, because it is much clearer. This is the hilum, and above the hilum you can see this big groove. It is very clear. This is a groove for the azygos, for the arch of azygos vein. Of course, this is the region of the esophagus, in the front of it trachea, in the front of the trachea right brachiocephalic vein, and this is the angle of the first rib. But below the esophagus, trachea, brachiocephalic vein, below them is a groove for the azygos arch, separating these three regions of the esophagus, apotrachea, of brachiocephalic from the hilum. It is very clear. This is the groove for the arch of azygos vein. It is connected here with the groove in the front of the hilum that is for the superior vena cava, which is in continuity above with the region for the right brachiocephalic vein. While in the left lung, on cadaver, this is the left lung on cadaver. You can see the oblique fissure, how it is dips into the lobes, upper lobe and lower lobe, and it is loosening because it is covered by the visceral fluid. You can see the apex, the anterior border. You can see how the anterior border is notched, and this is the lingula. And this is the anterior border. This is the diaphragmatic surface. And you can see the grooves on the costal surface. Medially, I may see the medial vertebral surface. This is the hilum with the bronchus behind, artery above, and two veins anteriorly, which are not so clear, but we can manage them. Behind the hilum, this is the groove for the descending thoracic aorta. Above the hilum is the groove for the arch of the aorta. Above the groove of the arch of the aorta, this is the region of the esophagus and trachea, region for the subclavian artery, the left subclavian artery, and this is the region for the left brachiocephalic vein, and this is the angle of the first rib. You have to have a look on the samples by yourself, please. لا تعتمد على الشرح. الساعة 12:30 بالوحدة تمكوز عملي.